Good morning, good morning. Hello, wake up people. What's up, wake up family? It's your girl, Dr. Alexea. So happy to be back in the space with you all. I'm joined by my co-facilitator and our Woo founder, Shawnee Benton Gibson, my cousin, my fam, my friend. And so I'm so excited about today's conversation. We're going to be talking about COVID because COVID is still COVIDing. We're going to be talking about monkeypox because it's real, it's here, and we all are at risk. So tell your friends, tell your family to come join us in this space. Share the link, get your people to register. And if you can't be here with us in real time, please, please, please do catch the replay because this is valuable information. It's important information. And we all need to be on the same page. Media has a way of presenting things in a very far-fetched way to make us feel more comfortable than we should be about some of these issues, to make us feel like, oh, that's not a big deal anymore, or, oh, I don't need to worry about that thing. That doesn't apply to me. Yes, it does. We've already seen the mistakes that were made in the beginning of the COVID-19 pandemic, and we are currently facing a global health emergency. We're facing another outbreak, not a new or a novel virus this time, but still a virus that's very easily and readily spread. So we are gonna get into it. We are going to unpack that. I look forward to everybody's questions. So whether you're joining us on Facebook or joining us here on Zoom, please, please, please do jot questions in the chat. Please do raise your hand when we afford the opportunity for people to speak and come on and ask questions in real time. We want to hear from you. I want to know, what is the conversation about in your community or in your workplace? Have you even heard of this thing? Do you know anybody with it? Are people in your community talking about it? And what's that conversation like? Because we could all have completely different perspectives about the same thing based on who we're interacting with and who we're engaging with. But the facts are the facts and the truth is the truth. So we want to have a perspective of being open-minded, of being receptive to new information, and to just really try to get an understanding about what is going on around us. So I'm looking forward to it.
Anything we should have, cousin, as part of our participation with the session?
Maybe just a pen and paper if you want to jot down some notes, if there's something you want to go back and look up, if you want to reference some of the information that's being provided, if you want to get some more details, because there's so much to say in so little time. So, if folks want to explore more, pen and paper to jot down some notes.
All right, awesome. We're gonna make it do what it does. And family, please invite others to join us in the space. We are 6 strong and that's cool. But we all need to be in this conversation. So like cousin, I'm calling her cousin because she's my cousin. Cousin Alexea said, Dr. Alexea, invite people so that we can be educated, please.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. Stay woke. Stay woke. Stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, releasing. We're teaching, we're moving. Together, we're learning, discerning. We're striving together, together. We're leading, connecting, transforming together, together.
All righty. Hey, cuz.
All right. Before I get started into this talk, I just want to say that song is so powerful. And the share of the work that's been done in this space over the last almost 2 years now is
This past 2 years.
Yeah,
We started in March of 2020, and now we're in August, soon to be September.
Wow, so 2.5 years.
Yeah.
Incredible. And like how quickly time has flown by and how many things have changed in our lives over the course of the pandemic and over the course of time that we've spent together in the wake up space. So I'm Dr. Alexea, triple board certified infectious disease physician. I'm a mom, I'm a speaker, I'm an author, I am a cancer wellness coach, and I'm a stage 3 breast cancer survivor thriver. And I create healing pathways for total health and wellness, mind, body, and spirit. Today, we're going to be talking about COVID because COVID is still COVIDing. It's the reason that we even find ourselves in this beautiful space. And so, like Wake Up, so many incredible things have come out of being in this pandemic. It has made people transform their lives, their health, their way of being. It's changed the way we do business, and just the way we operate, interact, and engage with one another. We've seen scientific advances. We've seen a lot of education. We've seen a lot of misinformation. And so we've had this whole, just big spectrum of things come out of being in a time of pandemic. It's been good, bad, ugly, and different, and all sorts of things. And, just when people are sort of finding their way with COVID, just when we sort of figured out, all right, we've got a handle on this situation, here comes something new. So now we find ourselves dealing with a global outbreak of monkeypox virus. So we're going to talk about both of those things today. Because it's so important for us, especially our community, Black people, brown people, BIPOC folks. And I know we have our white brothers and sisters in the space with us as well. But for us, we always tend to be the group that is disproportionately affected by things. We tend to suffer the most when things are going awry. We don't necessarily get the information up front. We don't have the same access to resources. We as a community may not have the same health literacy, and we may be having different conversations around these situations that really more greatly affect us. And, monkeypox has the potential to be the same way. So I can't wait to chop it up with you all about this thing. And so for anybody who's joining us on Facebook or anybody who's here in the space with us on Zoom in real time, I definitely would just like to open up with what do people know? What's your understanding about what's happening right now, COVID, monkeypox, or otherwise?
All righty. So anybody in the space who is willing and able to share, you can raise your digital hand. You can feel free to unmute, which is unusual in here, but I want to make sure that we get the conversation going and flowing. So Naomi, Marie, Inez, Zakia, anyone have something to say about what you know about monkeypox based on what Dr. Alexea just put out there, or what you think you know about the current iteration of COVID? Please let us know. And y'all know I'm big on calling on people. I'm like, even if your response is, I don't know nothing, isn't a response. Abimbola, go ahead, beloved. You have to unmute. Unmute. Let me see if I can invite you. There might be something going on with her. Oh, there we go.
Okay. All right. Yeah, I was trying.
Yes.
Peace and blessing.
Welcome, Dr. Alexia. It's always good to
you.
see you. You're looking
morning.
wonderful.
Thank
So the
you.
only thing that I know, I heard Fauci talk about, Dr. Fauci talk about monkeypox and it is it sexually transmitted?
Yeah. So
Because he was saying about lifestyle and stuff like that. So that's why I was confused. Okay.
yeah, right. So that's a good question. And that is the way that this thing was presented initially, right? Oh, this is a sexually transmitted disease, and it's not. Has there been an association with sexual activity? Yes. But the important thing to know about the transmission of monkeypox and sexual activity is that the main transmission of the infection is through skin to skin contact, right? So there's a lot of skin to skin contact, including genital contact, when someone is engaging in sexual activity. But you don't actually have to have sex, intercourse, penetration in order to transmit monkeypox virus. It could be the kissing, it could be the hugging, it could be the squeezing, it could be the grinding, but skin to skin contact isn't the only way that monkeypox is transmitted. It can also be transmitted by respiratory droplets, right? So if you and I were in the same room and we're within 3 or 6 feet of each other, I'm talking, we're laughing, maybe we're reaching out, grabbing each other's hands, those little spittles are flying. That's a way by which someone can transmit or spread monkeypox. So this is a big deal. And the unfortunate part of the way the information was presented, yes, in that particular group, in where we first saw the virus in men who have sex with men, which means a lot of things. And even that's a whole hour-long conversation you could unpack. In that particular group who were first affected in this global outbreak, sexual intercourse or sexual contact was one of the major risk factors, but you don't have to have sex in order to transmit or contract monkeypox. So this is one of those things that we want to get very clear on in the midst of this conversation today. So I did make some slides just so I can stay on track and stay on course. But also just so we can sort of visualize the information. So Zakia, thank you, Zakia, for commenting in the chat. Zakia says, I've stopped focusing on COVID and I know nothing about monkeypox. And that's the thing, right? It's like, depending on what you're up to in your daily life, does this information pertain to me or not? Is it relevant in my day-to-day life? Is it likely to affect me and my household? We may know different things about the situation. But the other thing is, just like, I know for me, I'm like trying to tune out some of the news. I'm trying to tune out all of this input of negativity that's coming at us through our televisions, the radio, the phone, etc. So I kind of filter everything. I listen to radio that's not playing news. I don't watch news on the television. And I only go seek the information I want. So if we're not careful, we can miss out on a lot of important things. And us just not being aware of it is not going to protect us, and it might even potentially harm us. COVID is still COVIDing, and now there's monkeypox. So we definitely need to get into this. We all at this point have COVID fatigue, right? We are over it. We're sick of the mask. We're sick of having to be shut in and sheltered in. And it's, our third summer of COVID. And, a lot of us feel like, well, I did what I was supposed to do, whether that was I stayed locked down for 2 years and now I just want to be free. I had COVID vaccines or boosters. I had a COVID infection and I managed to be one of the lucky folks who survived it. And now I have some immunity. Like, can I go out and do what I want to do at this point? That's what people are feeling about this thing. And so let's chop it up so that when we are out and about, because we are individually free to move about the country and free to move about the planet, we just need to know how to conduct ourselves and how to best protect ourselves. And if we're taking a risk, we at least want to be aware. We want to choose the risk, right? We want to be in a level of comfort and be in a level of understanding when we're moving about the country or going to events or family activities or whatever they are, right? We need to understand what the risk is and what we're at risk for based on what's happening in the country and throughout the world now. And then we can move accordingly. Next slide, Shawnee. So COVID-19, you guys have seen this slide a bunch of times with me in the space, and I just keep updating the numbers. COVID cases worldwide, over 601 million cases of COVID worldwide. And keep in mind that, you know, in the United States and Europe and all of these rich developed countries, we take for granted that we have, and I'm not saying anybody in the space or anybody listening, but in general, we take for granted that we have vaccines readily available to us. There are countries in the world that will not see a COVID vaccine, that people have not ever been offered a COVID vaccine dose and will not see them till 2023, 2024, 2025. Meanwhile, the United States and other countries have like bought up in advance so many of the doses that are available and being produced worldwide, as well as started to produce them more locally. And we have a lot of our vaccines go to waste because there's not a lot of vaccine uptake. I looked at the numbers, and less than 35% of people above the age of 5 who are eligible for COVID vaccines have had at least one booster. And I know people are like, well, if the vaccine works, why I got to keep getting it? But that's just the nature of certain virus vaccines. And, you know, we talk about, you know, different iterations of things, right? We've been through different iterations of Wake Up and how it's presented. And, you know, our intro even has changed over the course of the time we've been in the Wake Up space, right? So just like we have a new iteration of Wake Up, COVID keeps coming up with new iterations of itself, right? We speak about different variations or variants of the virus, different mutations of the virus that can allow us to get infected over and over again. So some of these 601 million cases may be repeated cases for people. I have met people who have had COVID 3 and 4 times, which is not a benign thing. But out of those 601 million cases worldwide, there's been almost 6.5 million deaths. 6.5 million people wiped off the planet. And in spite of all of our medical technology, in spite of our vaccines, et cetera, well, I really shouldn't say in spite of our vaccines, because most of our COVID deaths occurred before vaccines were widely available. But we have had over a million, almost 1,040,000 COVID deaths in the United States alone. And right now we have an average of 396 daily deaths in the United States. So 396 people every day die of COVID in the United States, and almost 5,000 people in the United States are still being hospitalized because of COVID-19 every day. So when I say COVID is still COVIDing, it is still COVIDing. In the United States alone, 94 million cases. And then we're adding to that over 80,000 new cases every single day. So, you know, when we're walking around with this false sense that this pandemic is over, it's not. It's still COVIDing, it's still whipping ass, it's still taking our loved ones out of here. Someone I know who is very near and dear to me, very young, just transitioned from COVID-19. And, you know, for our family, for our friends, for our community, that death doesn't sting any less because everybody else has stopped worrying about COVID, you know? So we really, really have to continue to take this thing seriously, because the risk hasn't changed, right? And we, like I said at the top of the talk, right, we still are existing in Black, brown, BIPOC bodies, and we are still dying at disproportionate rates compared to our white counterparts. I've said it before and I'll say it again. Men are more likely to die from COVID. Men are more likely to die from COVID, but Black women are twice as likely to die from COVID as white men. That's a problem. And that is a multifactorial thing. It may be some of our health history. We may have predisposing conditions like diabetes, high blood pressure, being overweight and obese. We may have things like, breast cancer or other cancers. Cancers disproportionately impact us. We may have autoimmune diseases, which we are largely impacted by. We may have other compromising states, including HIV or AIDS, and maybe it's undiagnosed or maybe it's untreated or undertreated. But all of these are things that place us at an increased risk of being hospitalized, having complications of, and dying from COVID. And that's scary. That's scary. Anybody have any questions or comments? Let me check out the chat. Definitely you all, please engage with us in the chat. Okay, so I see there's some comments. So Inez says, all I know is that there's a new strain of COVID, but not much on monkeypox. COVID is what they talk about here in Chicago. People stopped wearing masks here too. Yeah, so there was this mass unmasking all throughout the country, right? And the unmasking wasn't really a public health decision. The unmasking was more about opening businesses, making people feel comfortable to return to restaurants and shopping spaces and things like that in order to revive the economy. But it really wasn't about COVID. So in the background or sort of behind all of the, it's no longer a state mandate or it's no longer a city or county mandate to wear mask, there was this thing, but if you're at high risk, you should still wear your mask, or but we still suggest you wear your mask, even though the larger conversation or the more the louder conversation was, oh, we don't have to wear these masks anymore. So I pretty much wear my mask, I'm gonna say 95% of the time. 100% of the time in the grocery store, I'm in a mask. Although I was in Washington, D.C. this weekend and I found my way into a CVS with no mask on. And that's the first time I've done that since the pandemic. But I'm in my mask pretty much all day at work. I don't have a mask on because nobody's in here, but even if I wasn't in the wake up space, I would most likely walk into my office with a mask on, or put one on as soon as I got here, even when I'm here alone, because I don't know what the cleaning guy did before I was in here. Did he wear his mask or did he not? I don't know if my staff was in here and what they're up to in their own personal lives, but did they wear a mask or not? So I'm in the habit of being masked pretty much all the time if I'm indoors outside of my home. If I'm kayaking, if I'm on a beach, if I'm taking a walk, if I'm riding my bike, I'm not wearing a mask outdoors in wide open spaces, but masking should still be a thing. And school is restarting, and with COVID and vaccine uptake being really low in school age children, we could certainly consider masking our children when they return to school, as well as, if we're returning to workspaces, or if we're going to certain gatherings and events, et cetera, it is important that we still consider to wear masks. Mask use is not over, it's not dead. It's an important thing to continue to do, especially as we enter into the fall season. As we move into more indoor activity, we're going to see that there's going to be increased spread or increased uptake of COVID. So let's see. Tanine says, does the mask still support us in decreasing the spread of COVID? We've gotten comfortable because we've received mixed messages. So yes, absolutely. The mask still supports us in decreasing the spread of COVID. And your mask protects you, right? If we're using the airplane analogy, put your own mask on first. you know, they try to have this altruistic approach, like, oh, if you won't wear a mask for yourself, then wear a mask for the person who you might spread the infection to if you had it. I'm gonna say take care of self first, right? Fill your own cup, put your own mask on, protect yourself first and foremost. So your mask does protect you from the spread of COVID-19 infection. And I can attest to that in that I have been in, you know, my little 8x8, 10x10 exam rooms for a half hour, 45 minutes with people who have COVID. And sometimes I don't even recognize that they have COVID. So I just maybe only have on a regular surgical mask as opposed to having on an N95 or KN95, which when I'm wearing those masks, I wear a surgical mask over top of them. And then I wear some sort of eye shield, whether it's a full face plastic clear eye shield or face shield, or whether it's an eye shield on top of my glasses. But I have been in closed up spaces with people who have COVID for quite some time. And, you know, if someone has been misleading at the start of their encounter, or they came in for another thing and then just sort of mentioned something else that prompted us to do COVID testing, and we found out they have COVID, and I've only had on a surgical mask. I have not ever been infected with COVID in the clinical setting. I got COVID in May, I think it was May, and I got COVID while I was visiting family for a family health emergency. And I got COVID, I believe, from my dad, who had no symptoms. And he and my uncles were really the only people I had been around indoors unmasked. So I know that masks work. I wear my mask for me. I don't want to give nobody COVID, but I don't want to get it from people. And I have to protect myself from the people that I'm taking care of. The mixed messaging was, you know, partly some I'm sorry about that, y'all. The mixed messaging was partly some misinformation or disinformation. You know, there was a lot of lies told where people said, oh, the masks don't work, or, you know, the masks only stop you from spreading the infection to another person, but they don't protect you from getting COVID. That is an absolute lie. Masks still work, and you can ask any health professional whether or not masks do work. And there's no risk or toxicity. You're not going to get carbon dioxide poisoning. You're not breathing back in your own air or anything like that people are, you know, saying as a reason to not wear a mask. So we really want to be careful and mindful of that.
Awesome. So you want to go to the next slide, cousin?
Mm-hmm.
All righty. Hold on a sec.
Naomi, I'll come back to your comment also.
Yeah. Here we go.
All right. So this is a very busy slide, but it's an interesting slide and it's an important slide. So this is the incidence of death per 100,000 people in the population. And I do believe it's per 100,000 people in the general population, like how many of those folks are Black, how many of those folks are white, how many of them are Hispanic, Asian, or Pacific Islander, or how many of them are American Indian or Alaska Native folks, right? So if you, and it's over time, right? And so there's been some peaks and lows over the course of the pandemic, right? So if you look early on in the pandemic, look at where Black folks were. We are the orange dotted line. So very early on in the pandemic, and we know this, we experienced this, right? We outpaced other folks in deaths from COVID-19. And overall, like when there's a peak for everybody, but certain groups at certain times seem to outpace other groups. And there's a number of reasons for that. So our Native population really has some disproportionate impacts and outcomes as a result of the COVID-19 pandemic, dying a lot more, much less access to healthcare. But then as the vaccines became available, they ended up being one of the more highly vaccinated groups or populations across the nation, because their elders recognize like, hey, this thing is decimating us. It's really taking our people out. So there was certain groups of Native American folks or certain tribes who really were highly vaccinated once vaccines became available, because they were really disproportionately impacted by the virus. Also, if you look at what is happening with Hispanic folks, we see a lot of peaks there. We see that green line is peaking out at a lot of times when there was peaks in the pandemic, and where our current numbers are, right, July and beyond, we see that Hispanic folks are kind of at the top of the peak for the last two increases or increased waves or peaks in the pandemic. So minority populations are, we're not minor people, but in terms of the numbers that we're outpacing our white counterparts, but there's significantly less of us overall in the country, is really a big deal, that we're making up the larger numbers of or larger proportions of people who are dying from this pandemic. So I think it's important to just kind of have a visual and to really break it down and see who is this thing affecting, right? Because it's affecting us. It's infecting us. And if we're more likely to die when we get infected, or if we're more likely to die when we are hospitalized, and we have less resources, we have less equipped hospitals, we don't have access to clinical trials, or we may be a little hesitant to participate in clinical trials. All of these things have an impact. All of these things have a negative outcome on us. So the last thing I will say is, if you find yourself infected with COVID, please do seek medical attention. We do at least now have several interventions. So if someone is hospitalized, you may have an IV infusion of an antiviral drug. The monoclonal antibodies are not really readily available anymore. And we're finding that with the newer variants, they've been less effective. So we'll see what happens with that. We've used pill forms of antivirals, we've used steroids, as well as a number of other supportive measures like inhaled medications to help open up the airways. And then, of course, people are using some of the things that can quote unquote boost the immune system, more natural remedies and things like that. But if you have a symptomatic COVID-19 infection, you need to seek medical attention within the first 5 days of your infection. We found that like the 5th day is a critical point where some people will reach a point of no return. If people go into respiratory failure, if they get that pneumonia in both of their lungs, if they start having these clotting events and things like that, many people will reach sort of a point of no return where even with all of our wonderful medical interventions, we're not able to bring some people back, or we're not able to bring them back to where they were and who they were prior to their COVID infection. So please, 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 as soon as you can, seek medical attention if you get diagnosed with COVID-19. If you don't have on hand and you haven't already ordered your home COVID test, please order those COVID kits. They are very valuable for trying to figure out, okay, is this headache? Is this congestion? Is this little cough I'm having? Is this low-grade fever with not much else that I'm having? Is it COVID? Is it a common cold? Is it my allergies? I can't tell you how many people have come here and tried to convince me they're having allergies and they have COVID. Is it that before you go to that wedding, that baby shower, that brunch, that birthday party, that festival, right? Make sure you know, and really let's get into the habit of whether it's COVID or not. If you don't feel well, please stay home, because we don't want your COVID. We don't want your flu. We don't want your monkeypox, which we're going to get into. We don't want We don't want anything. We don't want any of your stuff. Like, stay home with that. Stay home, recover, take care of yourself, because you may cruise through something. You may breeze through something. You might have a headache for one day, one sniffle, a cough, and it's over for you. But it could kill somebody. It could hospitalize somebody. It could lead to somebody's heart attack, stroke, blood clot. It could, really disable a person. And that's the thing we keep taking for granted, is that we hear of so many cases where people have cruised through COVID and they've been just fine. Or you have people who want to announce that they did just fine when they had COVID. But what about the over 1 million Americans who died? What about the over 6.5 million people around the world who died? And what about the people who never recovered back to their baseline, who are left on oxygen, left with massive disability, lost all their muscle mass, lost the ability to breathe, dealing with long COVID, chronic headaches, chronic muscle aches, joint pains, brain fog, weakness, people who are disabled practically because of long COVID, no matter how mild their symptoms were. So we don't know if we or somebody else is going to end up with that. And it can really have significant impacts on your quality of life, your ability to produce, to take care of yourself, take care of your family. So to me, in order to avoid all of that, I just keep wearing my mask, even though I'm vaccinated, boosted, even though I had, a relatively mild infection. I tend to think my infection was mild just because I was vaccinated and boosted. Because when I get sick, sick. Like, I crash and burn from things. So I can't take any chances with this body. And I don't suggest that you do as well. So let me go to the chat and just make sure I cover everything. So now Naomi said, I don't intake any of what's going on in the world anymore. That television tell lies to your vision. Woo! That's powerful. It's true. It's a bunch of lies on the television, especially some of these news outlets. Like, I can't even believe that it's legal for some of the things that are being said on the news to be said. Like, how is that even possible? How is that a thing, that we just allow people to spew lies and misinformation on the television for mass consumption? Because not everybody is as brilliant or as awakened, or many people do not have the ability to discern the same way the people that show up in a space like this have. And so, yeah, a lot of lies are told. It's confusing. And yes, they're trying to keep us in a fear-based mentality. Fear is paralyzing. Fear can really make people take inaction. It can make people fall prey to a lot of things. So Naomi says, I continue to believe that I and my children are protected with the herbs, spices, and foods we use or eat to boost our immune system. That's right. We can really nourish our bodies. We can feed our bodies. We can supplement ourselves to improve our overall health and well-being, to improve our immune system, to improve our body's ability to reduce inflammation, to make white cells, to keep our immune system functioning, so that we can protect ourselves, so that our bodies are ready to fight, and so that our bodies don't go into overwhelm and completely implode in the face of something like COVID. If we at baseline are much healthier, we are in a better position to handle the infection. But that being said, there still will be some healthy people who succumb to this virus. And that's not to say that you shouldn't be doing what you're doing. Yes, feed your body, nourish your body, supplement. And then, of course, we definitely want to be exercising, moving our bodies, getting adequate sleep, right? Sleep is critical to our well-being. So do all the things. And thank you for your share, Naomi. Let's see. Why do some people lose their sense of smell and taste after getting COVID? So the loss of sense of taste and smell with COVID is just from direct inflammation and injury to our olfactory nerves, which kind of sit right above our nasal cavity. So a lot of the infection really starts to propagate in the upper airways, and so directly damages that nerve. that provides us or those nerves that provide us the sense of taste and smell. And I have patients who 2.5 years later still cannot taste and still cannot smell. And for me in the beginning, that was like one of my talking points. I'm like, can you imagine life without the ability to taste or smell? Like our sense of smell is protective, right? Think about smelling smoke, smelling your bad breath, your baby's diaper. Is the food ready? Is the food burning? As well as think about all of the positive things about smell, right? When your partner smells yummy, when you light that scented candle, when do your self-care and you're using an essential oil or some form of aromatherapy. And then taste, right? Our sense of taste. Is this food bad or is this food so delicious and so good to my soul? And, food is important, not just for nourishing us. It's one of our pleasures in life. It's one of the ways in which we comfort each other. And if that is disrupted, that's a huge quality of life issue. So we don't want to lose that. And we don't want to have any of the other issues that can come from there. So Naomi added, they were putting COVID on people who were dying of other things other than COVID. I had 2 family members who died, one of a stroke and the other had a heart attack, and COVID was on their death certificate in 2020. So that's it. So people can have a heart attack or a stroke as a consequence or complication of COVID-19 infection. So you kind of have to know, did they maybe test positive for COVID or not? Did they maybe have a presumed COVID infection because of other things? Usually a death certificate doesn't just say one thing on it. It usually will have the primary cause of death was this, and it was secondary to this thing. And they'll ask other things. Was it a pregnancy related death? Did the person smoke, and did that contribute to the person's death? And then they'll also say, like, the contributing factors, how long were they at play? Were they in play for years, months, weeks, hours, minutes, right? So, and the reality is that people had COVID with a lot of other things going on, because there was so much COVID circulating in our communities that people would get shot, and they're in the hospital because they were shot, but they also tested positive for COVID, and everybody got tested for COVID once they entered an emergency room space, because you had to know how to separate people who were being admitted so you didn't have in-hospital outbreaks. So yes, COVID was listed on a lot of things, and it may or may not have been a major player, but you could have had a COVID-related heart attack or stroke, or you could have had a heart attack and a stroke, and there was an incidental finding of COVID. So I know a lot of people are trying to make that mean something that it doesn't really mean. Hospitals had to identify how much COVID they were seeing in order to get state and federal funding, right? And funding that was COVID relief or COVID support for hospitals, health clinics, medical centers, et cetera, was based on how much COVID you were seeing. So people or healthcare systems had to document that. I know there's a lot of feelings and opinions out there, and probably all or most of it is valid. But yeah, I totally understand where you're coming from, Naomi. It can become a loaded conversation. And there's a lot of stuff behind it that even as a healthcare professional, I may not know, right? I'm just here showing up, operating in altruism and doing my job and trying to just take care of people. So I was asked to share two pieces of misinformation on COVID that have been broadcasted on television. So there's a lot of myth around, is it dangerous to wear a mask? And it is not. People saying, oh, you're breathing back in your own bacteria and that's dangerous. No, we live with our normal flora on a day-to-day basis, whether we have a mask or not. Or people saying, oh, you're breathing in too much carbon dioxide. No, we're not. And our body can really tightly regulate carbon dioxide. And, masks are breathable. We can have sufficient air exchange. If we were breathing in too much carbon dioxide, then healthcare professionals and surgeons who've been wearing, this kind of medical equipment as needed for patient care, for surgeries, whatever, for as long as we have had infection control measures in place, have done that and done it safely. Otherwise, if it was so problematic to wear a mask, we would have our surgeons like passing out in ORs when they're doing 8, 9, 10, 22-hour surgeries, right? And they just operate and they do just fine. So that is some serious misinformation. And then again, another piece of misinformation that I've seen talked about on television was this idea that your mask does not protect you, and it absolutely 100% does. So let's go back to the slides. We chopped it up a lot for COVID, and I was actually planning to spend the bulk of this conversation on monkeypox. But so let's get back into the slide. Let's get back into what's going on there, because there's a lot to learn and a lot to unpack.
All righty. Ready for it. Thank you, Doc. This is really powerful. And we need reminders about, it's easy for humans to forget details on what we've been through. So I love that you're rolling it back so that we can understand that COVID is still a thing. And we take care of ourselves. So here, you want to go here with this slide?
Yeah, let me just say 2 things about COVID that came up in the chat. So Sankofa Sojourns from Facebook said, I tried to order more free COVID home tests and found out that the government is discontinuing giving them away soon. Order your test soon. Yes, please do order your test. The most recent round of tests that you can use, you're able to order 8 kits. So I order every time that little message comes out, because it's a wonderful thing to have a free COVID test at home. They are accurate. If you're positive, you're positive. If you're negative, think about your symptoms, think about how long you've been symptomatic, and maybe you want to retest in another 48 to 72 hours if you're symptomatic. You can generally trust the rapid test. If you're symptomatic and your test is positive, it's real. If you're symptomatic and your test is negative, it may be too early, may have not gotten a good specimen, or you may have something else and you can get tested to see what you have. Only go to the emergency room if you're having emergent symptoms. You can't breathe, you're having chest pain, you can't eat or drink, you're dehydrated, you're feeling faint, dizzy, like you're going to pass out. If you feel pretty decent, but you have a cough, maybe a fever, you can see your primary doctor and they can work with you via telehealth. That's one of the gifts COVID gave us, is telehealth everywhere. Or you might be seen in an emergency room, an urgent care center. Try not to clog up the emergency rooms with non-emergent symptoms. Let's see, go to 2 different sites, take a rapid and a PCR, and get different results. One positive rapid and one negative PCR, and the other one I had a negative rapid and a positive PCR. So PCR tests are generally more reliable, but again, the rapid tests are usually pretty reliable as well. So some things that can happen is things that I get concerned about, right? Did a specimen get contaminated? I mean, think about where people are going to these mass testing sites, and is the person who's doing the test changing their gloves when they got a mile-long line of cars and they're just sticking their hand in a car and swabbing your nose? So are specimens being contaminated? Was proper procedure used, right? If it's a test that requires them to go all the way up into your oropharynx to get a specimen, did they go far enough? Did they get an adequate specimen? I've had patients who had false negative tests, and when I asked them, was it uncomfortable? Did it hurt when you got the test? They're like, oh, no, it was easy. They just, tickle my nose. I'm like, no, the test you had required that they go up your nose and kind of tickle the back of your throat with the swab. So testing methods can interfere with testing results. So So I hope that helps to clarify some things. There's a lot of things that can go wrong with testing. Sometimes human error is at play, but also no test is perfect. You will have a false positive and a false negative rate built into every test. So be cautious, be cautious, be cautious. If you have symptoms, stay home and retest if you're concerned. So monkeypox. So monkeypox has been declared a public health emergency here in the United States, and the number of cases of monkeypox continues to rise in the United States and other countries. Throughout the world, the number of cases is approaching like 50,000 for the current outbreak. And here in the United States, we currently have about 18,000, I think 100 confirmed cases of monkeypox, right? So not every case is going to get confirmed because some people aren't going to get sick, or they don't recognize their lesion as a monkeypox, or maybe somebody doesn't have access to medical attention, but confirmed cases is 18,100 cases. I just on, what's today? Today is Tuesday. On last week, Wednesday, I gave a monkeypox lecture to a group of health professionals. At that time, the cases in the United States was 16,909. And I'm got a weird brain, so I remember that number exactly. So from Wednesday to today, we went from 16,909 cases to 18,100 confirmed cases, and that number will continue to grow. So on July 23rd, the World Health Organization declared monkeypox was a public health emergency of international concern. We saw that with COVID, and here we are again. Next slide, please. So how is monkeypox spread? At the top of the talk, someone inquired about whether or not monkeypox is a sexually transmitted infection, and it is not. There has been an association, there has been a link to sexual intercourse, but the sexual transmission or the relationship or association with sexual transmission is more about the hugging, the kissing, the prolonged skin-to-skin contact, the grinding, the spending close and intimate contact together. And you can see monkeypox on the sexual organs or the genitals, the mouth, the vagina, the penis, the anus, the rectal mucosa, or those, soft tissues. But it's more about the skin-to-skin contact than necessarily the sex itself. So in addition to being spread that way, we can pick up monkeypox through respiratory droplets from prolonged close contact, right? So if we were maybe in a small conference room, or maybe in my office, and maybe we're all sitting shoulder to shoulder, if we had this session in person, if I had monkeypox, I'm talking, I'm excited, there's probably some little spittles flying, I can cough, breathe, or sneeze monkeypox out into the space, and it can be on, the desktop, the tabletop, things that we might have prolonged contact with, or my respiratory droplets can land on your face, in your mouth, in your nose, etc., and I can spread the virus that way. So if you watch the news, or if you're active on social media, you probably saw the story of the young Black woman who was the first case of monkeypox diagnosed in a woman in the state of Georgia. And she reports that she had not been sexually active. And she said to people, I know y'all probably think because I have lesions mostly around my mouth and on my face that, maybe I had a sexual contact. And she's like, I did not. Her only risk factor was that she worked in a gas station. She was not wearing a mask, and she was handling a lot of money. So she's in contact with many people over the course of the day. She has to touch things that other people are touching. And her concern was, maybe I touched contaminated money or the countertop or some other thing. And then maybe I went and ate food, or I touched my face, which, if you're watching me on the screen, you notice I touch my face countless times. Humans touch their face on average 120 times per hour. So hand washing, hand sanitizer, all those things are still in full effect, not just for COVID, also for monkeypox, okay? And then I mentioned already, touching contaminated surfaces and then touching your skin, your eyes, or your mouth is a mode of transmission for monkeypox. So next slide, please. And definitely, if 120 times per hour, isn't that something? So years ago, somebody did a study and they just put a camera in like a college lecture hall, and they literally counted how many times this room full of young adults touched their faces. On average, it was about 120 times. I put this slide up because I felt that it's important to do some myth busting and to handle some misinformation. So we already talked about whether or not monkeypox is sexually transmitted. And yes, sexual contact is associated with spread of monkeypox, but it's not a sexually transmitted infection. The other thing is that when monkeypox first began being diagnosed, it was being diagnosed predominantly in men who have sex with men, and or gay men. And I'm saying it that way because there's men who have sex with men, who have wives, who have children, and they're going home to those folks every day, as well as men who have sex with men, live life just like we all do, right? So we cannot separate out one group of people based on their interpersonal relationships or the way in which they express themselves sexually and act like they're not having the same lived human experience as we are, right? Folks have families, folks go to work, folks ride the bus, ride the train, drive a car, delivering your Uber Eats, working in the spaces that you frequent and visit every day, and the world is wide open. So we are just going about our business, doing all the things that we normally do. And so because of the way in which monkeypox is spread, we are all susceptible. Unless you had a smallpox vaccine, you have no protection against monkeypox. You are non-immune. And so it's like COVID. We can all get this thing. So one of the things that I sort of touched on but didn't really dive into is the contact with inanimate objects in terms of spreading monkeypox. Clothing, right? Shared clothing. I'm cold. I'm out with my friends and my girlfriend takes off her sweater and gives it to me because she's comfortable and I'm freezing. Maybe she has monkeypox and doesn't know it yet. Now I'm wearing her sweater that she's been wearing, and I can get monkeypox from that. You can get it from bedding. You can get it from towels. So these are things that you don't want to share, right? And think about things like when you maybe go to a public gym, right? And you grab a towel, or you lay on top of a towel, or you and your buddy are working out together in tandem, and you use a towel to cover the bench before you do some weightlifting, but you and your friend are sharing the towel. Well, if your friend is sick, that towel, bed linens, etc., can be a way in which the virus can be transmitted from one person to another. A massage, if your massage therapist is sick, or your friend, every time my girlfriend comes over, she massages my shoulders. I have friends like that. I have relationships like that. What if that person is sick and they don't know it yet? That can transmit the infection. So I want to tell you guys about a couple. So packages, it's possible, but we don't tend to have prolonged contact with packages, right? So if we're washing our hands frequently, if we unbox our Amazon package and then we go wash our hands with soap and water, or we disinfect our hands, or if you did like people did in the beginning of the pandemic, you disinfect your packages before you touch them, that should be okay, because disinfectants, bleaches, soapy water, things like that can disrupt the virus. So we're still going to be in the habit of wearing our masks, washing our hands, not touching things as much as we can. But am I stressed about touching the doorknob in Target? Well, we don't really touch doors to go in and out of many places anymore, but am I stressed about touching a doorknob? No, because I'm a hand washer. I'm a frequent hand sanitizer user. But if I'm hanging on to the shopping cart at the grocery store for 20 or 30 minutes, that I'm going to wipe down with disinfecting wipes before I use it and clean my hands after I've touched it. So I don't want you to feel like, oh my God, now we can't touch anything. You can touch things. You just need to continue to be in the habit of frequent hand washing and frequent hand sanitizing, like we began to do in the pandemic. So I show all these groups of beautiful people because we're all at risk. And think about how we engage socially, right? Kids tend to be right up in each other's faces or all over, sleepovers, play dates, all of those things. We need to protect our children just like we need to protect ourselves because children are at risk. There was a exposure case in Illinois where 30 to 40 children plus 10 or more other adults were exposed to monkeypox. A teacher in a school had a confirmed case of monkeypox, but before he was diagnosed, he'd spend prolonged amounts of time with his students, his colleagues. They felt that many of the children and other adults were exposed also by the handling of inanimate objects, right? So think about in a school, maybe, you're using dry erase boards, or maybe you're using like clicky things for PowerPoints or remote controls for televisions or other electronics, right? We touch so many things and pass so many things back and forth. So the CDC had to emergency use authorize the monkeypox vaccine for these children so that they would not hopefully come down with active infections after they had this significant exposure. We're starting to see increasing number of cases in women and children throughout the country. And so we have to worry about that. We have to concern ourselves with that because this is not a gay man's infection. Although in the media, we talked about what are the lies, what are the misinformation. In the media, that has been suggested, or that is the messaging that people are getting. So, look at what happened with HIV and AIDS when, people said, oh, this is a gay related immune disorder. No, it's a human issue. It's a infection that can be transmitted through the exchange of blood and body fluids, right? That is the case for HIV. And so stigma kills. Stigma is harmful. Stigma does not allow people who are at risk to understand their risk and to protect themselves. So any of us can get this infection. And again, unless you had a smallpox vaccine, which really only applies to our military, people who are like world travelers, or people who are doing like missions work and they travel and work in areas where monkeypox is endemic, which is like parts of Western Africa and I want to say Northern Africa, but I could be mistaken. I need more coffee. It's early in the morning. So people who have traveled to those areas may have been vaccinated, but by and large, we are all unprotected and therefore we are all susceptible. So we need to keep that in mind. So we have approached the 8 o'clock hour. I'm going to request maybe another 10 or 15 more minutes of your time. I certainly welcome questions. I see that folks are still being active in the chat. So Sherry asked, how can we protect our kids who are returning back to school? Encourage them to continue to wear their mask, encourage them to continue to utilize hand sanitizer and wash their hands. Encourage your children to speak up if they don't feel well, and encourage the adults in your life to speak up if they don't feel well. And let's continue the habit of not going to work, not going to school, not showing up for stuff when we don't feel well, because it's dangerous, and it is dangerous, and it's very American to go to work sick. It's very American to give your kid Tylenol or Motrin and send their little butts to school where they got them cooties from. That's what we do. I got to go to work. These kids got to get out of here. Don't you go to that nurse's office complaining. If you don't feel good, you better suck it up because I can't leave work again. That's what we tell our kids. And so they're going home. And I mean, they're going to school. We're going to work. And it's not a good thing. It's not a good thing. It's not a good thing. So it's great if you tested out of COVID. I've just been informed I have till 8:30. I didn't realize that. I don't know why I thought I had an hour. So keep rocking with me, people. And if you can't rock with us till 8:30, my contact information is in the chat. So we would encourage you to catch the replay, pick up where you left off if you have to leave the space. But thank you for tuning in. And if you're heading out to work, but you don't feel good, don't go, stay home, work remotely if it's an option. Take that COVID test. But again, get into the habit of not showing up to work and other places sick or feeling like just because you have COVID, it's okay to go. Because there's other things that are minor for us that are major for people who have other risk factors, and we'll take them out just like COVID. So please don't take that for granted. Next slide, please, beautiful people. So, with monkeypox, the rash is the big deal for this infection. And I felt it was too early to be showing y'all people's rectums and anuses because I had pictures of that. I was saying with Cheryl, I have to take some of the excitement out of these slides because this is very early in the morning for this stuff. But here's different examples of monkeypox lesions on different colored skin, because things can look different on Black skin versus white skin versus brown skin versus yellow skin versus whatever skin, right? And the lesions don't only appear on the skin. So somebody could have monkeypox, but they might only have lesions on their genitals or in their rectum or in their vagina. And they can still transmit infection, again, because there's that respiratory spread, or, maybe they're not a good hand washer and they touch the lesion and then they, touch some other inanimate thing that you now are going to subsequently come into contact with. And this is an important point because when this outbreak first started, when we weren't really talking about it very widely, and when the rules to get a vaccine for post-exposure, or when the rules to get some TPOX, which is the treatment for monkeypox, from the CDC first landed, you had to have skin lesions. And so for people who had acquired their infection through sexual contact, who had like rectal lesions that were not visible to the eye but causing them an incredible amount of pain, these people were not taken seriously in healthcare settings. They were not able to get access to the drugs, or their access to the drugs were delayed because their providers were looking for these more classic lesions on the skin. So not everybody is going to have a skin lesion, and the skin lesions change over time. So in the beginning, the skin lesions may just look like a regular old boring pimple. And the skin lesions could be anywhere: the face, the mouth, the back, the arms, the legs. They can be anywhere. Most often, a person will have lesions at the site of the original contact and then spread to other places in the body. You could have a single lesion. You could have very few lesions scattered about the body. You could have multiple lesions, like this poor soul whose mouth we're seeing, where they have clusters of lesions around their mouth. You can have clusters of lesions all over the body. Or you could just have a few lesions. People can get lesions inside of their mouth, inside of their throat, around their lips. So on the bottom of the page where that picture is marked C, where you see the person with the open mouth, the lesion is actually in the right corner of their lip, right? I don't know if you can make it out on your screen, but there's a little pus pocket there, and that is their monkeypox lesion. The slide that's marked D is a lesion on the tongue. And some of the scarier lesions that I took off this particular presentation were lesions in the throat. So people had pox marks, big ulcers, big blisters on their tonsils or in the back of their throat. And the way these lesions present, or where they're present, can have different complications. So when we talk about children, how do children explore things? Toddlers and small children, they put them in their mouths, right? They mouth things, pencils, pens, toys. Little children who go to daycare, they get herpes simplex type 1 virus or cold sores and fever blisters. That is very commonly spread in the daycare center because the kids are swapping spit all day. They hug and kiss each other. They share food. They take a pacifier out one kid's mouth and put it in their own mouth. and they're mouthing their toys. That's how small children, infants, toddlers explore their environments. So children with small airways can actually have their throats crowded or closed off, because I know I'm killing Cheryl with the slide. We can move the next slide. If I'm killing Cheryl, I'm definitely killing somebody else with the slide. And these aren't even the worst ones. But small children, if their tonsils get very enlarged, if their throats get very swollen, it can crowd out their airway and they can have respiratory difficulty. So they may need to be hospitalized for that. So the rashes, they can start as little pimple-like lesions, and then they become larger over time. They may look like, big domed blisters, or they may have like what we call an umbilication. So they may have like that little donut-like appearance. And then eventually they will crust, like they will shrink down. The blisters will kind of deflate. They will crust over, and then the scabs will fall off. As long as a person has any active lesion, whether it's pimple-like, blister-like, donut-like, until that lesion crust over and heals, that person is contagious. So people are generally symptomatic and contagious for 2 to 4 weeks. And the rash may not be the first symptom. Sometimes people get flu-like symptoms, right? Which is language we throw around. You get flu-like symptoms with everything. A new HIV infection, mononucleosis or the kissing disease, the flu itself, COVID, monkeypox, chickenpox, which, by the way, monkeypox and chickenpox are not at all related. So if you had chickenpox infection, or if you had chickenpox vaccine, or your kids did, so what? It doesn't have anything to do with monkeypox, and it does not protect you. But what these things have in common is what we call a prodrome. So these early flu-like symptoms that people get, where they're just feeling unwell. You can have fevers, you can have chills, you might have swollen glands or lymph nodes at the site of somewhere near the site where you contacted your infection. So let's say you got your infection through kissing, or, I don't know, sharing drinks with somebody who had monkeypox, let's say. And so your mode of transmission is largely oral. You might first start to experience swollen lymph nodes around your face, so around in front of your ears, behind your ears, in the front of your neck, the back of your neck. Let's say it was like you were rubbing arms, you're dancing, you're hugging, you're hanging out with your friends for hours, and you find out a week or 2 later, oh, so-and-so had monkeypox. If the skin of your arm, or if your hands was your mode of transmission, you might have swollen lymph nodes in your armpits or just above your clavicles. For those folks who had genital exposure associated with sexual contact or sexual intercourse, they might have swollen glands or lymph nodes in their groin. And they may not have that at all. But you can have muscle aches, joint pains, back pain, headache, respiratory symptoms, sore throat, nasal congestion, cough. Don't this sound familiar to y'all? So now we're dealing with, is this monkeypox, or is this COVID, or is this something else? Because really, when we say flu-like symptoms, what we're saying are sick symptoms, because we get these symptoms outside of flu. It's just we make that association, or when we say flu-like symptoms in general, we know we're talking about any combination of these things: the fever, sweats, chills, muscle aches, joint pains, fatigue, headache, just feeling unwell, having malaise. And then those symptoms may be followed by the rash in 1 to 4 days, or some people feel perfectly fine and the pox marks just start popping up. Some people get the rash first, and then they get all of these other symptoms later. Some of the things that are unique to monkeypox and very few other infections is they can appear on the palms and the soles. Very few things appear on the palms and soles. So if you get palmar rashes or rashes on your hands and feet, you should seek medical attention, because there's only a handful of things that do that, and they all require workup, testing, and possibly treatment. So rashes on the hands and soles is a big deal. I talked about they can be pimple-like, they can be blisters. People have described the lesions as being incredibly painful, like having excruciating pain, and pain is a reason to seek medical attention. If you have large numbers of blisters, that's a reason to seek medical attention. Well, if you have any monkeypox, period, please go seek medical attention. But you might be offered treatment if you're one of those people who have lots of these lesions, and if they're very painful. And then they may be itchy, they may be painless. So absence of pain does not exclude monkeypox. Absence of itching does not exclude monkeypox, right? It can present different ways in different people. And we also know this to be true of COVID. So, you know, we just have to know what's going on in our bodies. Next slide, please. So please, if you have symptoms, if you've had exposure, please do seek medical attention. Cheryl said, is it a cold? Is it the flu? Is it COVID? Is it monkeypox? Yes. So for me, it's like, you know, COVID and monkeypox and polio, oh my, plus all the other things. Pregnant women, pregnant women, pregnant women. You know, this is a space where we talk about pregnant women because we know pregnancy is a high risk time. We know pregnancy is a relatively immunocompromised state. We know that pregnancy outcomes are different for Black and Brown BIPOC women. So like COVID and like flu and hepatitis and any other virus, pregnant women are at increased risk for severe infection with monkeypox. And we know from smallpox, which is also in the same family of orthopox viruses, pregnant women are more likely to have severe illness, and they can have hemorrhagic or bleeding complications and increased risk of death. There can be adverse pregnancy outcomes, including pregnancy loss, stillbirths. There can be what we call vertical transmission. So the virus can be transmitted mother to child. And so if a woman is diagnosed with monkeypox, unfortunately, she has to be separated from her baby. So newborns who are born to mothers who have monkeypox will be separated until they figure out whether or not the baby has monkeypox. So, and then breastfeeding should be delayed until it's known what mom's status is if there's concern, because we don't know if the virus is present in breast milk or not. So, you know, our pregnant sisters, our sisters who are planning pregnancies, our sisters who just have babies, please continue to be safe and be hypervigilant. Next slide, please. And so I've alluded to children. I love this little picture. I use it pretty much in every slideshow that I'm talking about germs, any cooties, any infections, right? I've been traveling recently, of course, just going in the grocery store, and I observed children walking through the airport, and every handrail, they just drag their hand across the whole handrail. They just walk and they drag and they just touch everything. I have observed so many children licking handbars, handrails, laying on the floor. And I don't know why children lay on, well, I know why they lay on the floor in airports. They're in there a long damn time, but please y'all get y'all kids up off the floor in these airports and stop letting them drag their hand down every surface and touching everything. Give them something to do with their hands so that they're not touching everything. Let them carry a suitcase, drag a suitcase behind them. You know, in the airport might be the one time where I would encourage you to give your kid a phone, an iPad, and let them just sit there with it, because at least then that'll probably be the only thing they're touching because it has their attention. But, you know, this could easily be germs. Think about this kid touching things. Imagine the handprints that would be left behind if this kid was touching things and transferred paint. Think about that paint as germs, and that your kid, me, you, whoever, is gonna pick up as we are coming through the airport, the grocery store, the pharmacy, wherever. So get your kids into the habit of touching things as minimally as possible. Make sure they have their own hand sanitizers and hand wipes. Make sure they use it frequently. You know, make sure they're not biting their nails, sucking their thumbs, and that they just are in the habit of cleaning their hands as much as you are, because they touch way more stuff than we ever will. Because for them, they are unbothered by cooties. They love cooties. They're looking for the cooties. It's just the way children are. So children who are under the age of 8, they are more likely to have severe disease. So they might be candidates for the treatment, the TPOXX treatment, that you can only get from the CDC. So your doctor has to confirm your diagnosis or be highly suspicious and then reach out to the CDC in order to get medications to you. We don't yet have the availability of these meds, so I can't e-prescribe to the CVS or the Rite Aid for you. We have to take some steps. So it requires a doctor's visit, but a telehealth visit counts. So you can do a telehealth visit, and you have to have a visit to make the diagnosis, confirm the suspicion. You know, you have to figure out how to get labs or get a lesion swabbed, and then you have to have 2 follow-up visits in order to qualify to get the treatment, because they're going to obviously take note of how people are responding to this treatment, because we haven't had to use it widely. Other things that place children at risk, of course, immunocompromised children. We all know children who have childhood diabetes or celiac disease or autoimmune diseases, childhood cancers. And then this is an interesting one, eczema. How many of us have children with eczema? I know my child was a different color every damn day with eczema as an infant, and she's a lot better now with it. But how many people have eczema or asthma and eczema in our lives? I know it's rampant amongst our children. That increases the risk of severe monkeypox disease, because you already have these dry, inflamed patches of skin that have bacteria living in them, whether you know it or not, or whether your child or you are having any active symptoms of any bacterial infection associated with the presence of eczema. But you throw some monkeypox in on top of that, and that skin is blistering and ulcerating and crusting. Things can really run amok. So people can get really dramatic bacterial skin infections or cellulitis. People can get skin abscesses. So children with eczema can do much worse with monkeypox than a child their same age who's otherwise healthy. Children can get encephalitis. Adults can get this too, but children are under the age of 8 are at increased risk. So encephalitis is inflammation of the brain. So imagine your child seems to be cruising along, and all of a sudden they're acting wacky, they're completely confused, they're out of their mind, they're talking gibberish. Take your baby to the hospital, because a lot of things can cause encephalitis, monkeypox included. It can cause pneumonia. A lot of these viral infections can get into the lungs. Probably a lot of people don't know that chickenpox can cause pneumonia, but it can. And if you have any of these other secondary infections or super infections on top of the virus, you can end up with sepsis. Sepsis has a very high mortality or death rate. So we don't want, we want people to seek emergency medical attention as soon as things look bad. I mentioned the airway obstruction due to swollen lymph nodes. People can get keratitis or inflammation of the eye and corneal scarring that can lead to vision loss. So we worry about what's called auto inoculation. So let's say your lesions are itchy. Let's say you're a skin picker and you just can't help but pick at that little pimple or that little pustule or that ulcer or crusting lesion that's forming. The virus that's live in there, you can transmit it to other areas of the skin. We talked about touching our faces 120 times an hour, right? Think about how quick we are. Something is irritating our eye. We just jam our finger in there and rub it, you know, get a little eyelash in there or your makeup goes in there. We just rub it. You can auto inoculate your eye and then end up with eye lesions, scarring, and potentially blindness or permanent visual loss or disturbance. So this is a hellified virus. It can do a lot of things. And again, we are all susceptible. Yes, when this virus first landed on the scene, it predominated in men who have sex with men. And literally the only reason that happened is that just happens to be who was patient 0, right? So when we talk about outbreaks, we talk about patient 0 and then where did it go from there? If I was patient 0, then monkeypox would be a disease of Black women physicians, Black breast cancer survivors, Black women entrepreneurs, but never would they get on the news and say successful Black women are experiencing this outbreak. They would just say, oh, we happen to see this infection in this group of Black women, but we need to understand everybody's at risk, right? Because I'm going to give my infection to the people who I'm hanging out with or who I'm spending time with. So I'm going to give it to my kid, my family, my colleagues or coworkers, just based on how it's spread, right? I'm going to give it to the friends who I'm shoulder to shoulder with, or the people who I'm brunching with, or the friends who I have over for movie night. And those are people who are up to the same thing that I'm up to. So the virus happened to first land in men who have sex with men. And because it's summer and people are traveling, there's a lot of, group gatherings. People are going to different music festivals, different events. People are, just clubbing, barbecuing, all the things. It's spread in that population because, birds of a feather flock together. Like attracts like, right? We just hang out with who we hang out with. But we also have to keep in mind, like I said, men who have sex with men also have sex with women, also have children, also have jobs, also engage with their mothers, their fathers, their grandchildren, their wives, whoever. So the idea that this virus was just going to stay in this population and that's the only group we have to be concerned about is a notion we have to release. Even if in most places 98% of the infections are in that group, that number is going to start to come down and it's going to equalize, and we're going to start seeing representation of this infection in everybody. So we have definitely seen already pediatric cases. We've seen cases in women, and we're going to continue to see cases in folks who fall outside of that particular demographic. So we just have to be mindful. So, I've had patients walk into my office and say, oh, I saw that monkeypox thing on the news, but I don't have to worry about that because I'm not a gay man. And it's like, no, we all have to worry about it. Our particular lifestyle may not put us at high risk, but the risk is not zero. And so I just want us to all be aware that COVID is still COVID in. Monkeypox is on the scene. And in New York State, we diagnosed a case of polio, which has been showing up in our wastewater since April. We've been seeing polio virus in our wastewater. That's a way that they surveillance what viruses may be coming along. They look at what's in our wastewater. That's how they're able to predict upticks in COVID, because people literally shed COVID virus in their stool. And so when they're screening our wastewater, we can see what's out there and see what we are at risk for and susceptible to. So if you're vaccinated against polio, you should be protected. We previously had vaccine eradication, and it is suspected that there are probably more cases, but many people may be asymptomatic or may have mild symptoms. It was the paralysis that is associated with polio that brought that case to medical attention. So the suspicion is that there's much more out there, and we might begin to see more cases in those children who are unvaccinated, or folks who may not have ongoing protection because they're immunocompromised for a number of reasons. So next slide. We are coming to the end. I know over the last 2 years, the CDC has gotten mixed reviews. I've talked to people who have said to me, I straight up just don't trust the CDC. And that's fine, but that doesn't make their information not valuable. There's lots of valuable information on the CDC website. If you need specific information about monkeypox and sexual health, if you need information about monkeypox, in people living with HIV, in children, in adolescents, and folks who are breastfeeding, certain high-risk groups. Or if you want to know more about testing treatment for monkeypox, if you want to read up on TPOX, the treatment for monkeypox that I've mentioned, you can check out the CDC website. One thing that is good about the CDC website is it just simply states the facts. It states it in a way that is very easy to manage. It doesn't require a whole lot of health literacy. The information is very easily understandable for anybody. So please do check out those websites just as a way to educate yourself and just to have access to the information. This has been a very loaded conversation. It's been a little heavy at times. And it's a lot to take in. So if you want to just go back to the information, here's some resources. And I think they'll also be provided in the chat. Next slide, please. You guys know who I am. I'm Dr. Alexea. My business and my brand is Warrior Wellness and Nutrition. I fully support and encourage a healthy mind, body, and spirit. It's one of the best ways that we can support our own health and well-being, especially in these pandemic times. We do not want to wait until we are sick to, to start protecting ourselves or start gearing our bodies up. So, eat well, hydrate, get enough sleep, supplement as you need to support your own health and well-being. Next slide, please. And of course, I thank you all so much for your time and your attention. We had to handle our business. We have to do some giveaways, and then we're going to talk about what's coming up next. We are right at 8:30, so we're sort of ending on time. And then if you have any questions, I welcome you to put any of them in the chat or to connect with me offline regarding them.
All righty. So I know I learned a whole lot in this space. I always learn a bunch from you, cousin, because you're just awesome and just like this wealth of knowledge to tap into. So thank you, thank you, thank you for showing up in this space as you always do, being magnificent and being generous and being relatable and being someone we can understand. Because sometimes, when doctors come into the space, it can get real wonky with just trying to process the jargon and get clear about what we need to know. So I appreciate you. We appreciate you as part of one of the founding facilitators and members of this community. So we have a special offer. Can you explain what they get?
So we got like a juicy crowd in here. We have 24 folks with us still in the space. And we had a lot more rocking with us earlier. So a lot of folks had to say goodbye and pop off. But the first participant who answers this question correctly, and what I'm going to say to do is to unmute yourself and just say the answer, will receive an immune boosting bundle. So what's in the immune boosting bundle? It is vitamin C, it's a B complex, it's vitamin D, it is elderberry, and it is zinc. So 5 supplements in my immune boosting bundle. And so let me think of a good juicy question. What is the name of the current COVID-19 variant that is circulating? And if you know the answer, I'm going to invite you to just unmute yourself and say it. And then I'll get to Robin's question. You don't have to give me the letters and numbers name. Like, you can just give me the name. Who's that?
That was me just saying, come on.
Oh, that's you. Like, yeah. I tried to give an easy question, but not too easy.
But we also said people have checked out. They may not know his name.
Ah, that's true. That's true. Let's see. I saw something go up in the chat.
Oh, wait, somebody unmuted. Athenia?
Say again?
The Omicron?
Yes, it's the Omicron variant. So the Omicron variant is the most recent variant to pop up. And we have had sub-variants of Omicron. So I think we're at like BA 5 and 6 for the Omicron variant. And in the fall, we're hoping that there will be a more Omicron specific vaccine available so that folks aren't being boosted with the same old vaccine. And, you know, hoping that we'll have the early success that we had with the vaccine as time goes on, because the new vaccine will be more specific to these more recently occurring variants. Who was that came off mute?
Athenia.
Athenia. Woo, 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 woo. Congratulations, Athenia. So I'm going to request that you email me. The email is there in the chat. It's agaffneyadams@gmail.com. Email me your name, your address, and say I won the immune boosting bundle, and I will have that mailed out to you. And then if you want the immune boosting bundle, please message me because it's not available as like one set order on the website yet. But I can package that for you at a discount. So if you're interested in that in the next 48 hours, please do email me and I will give you a discount on my immune boosting bundle. And then lastly, my journals, I have 3 journals. I know some of the folks in this space have received my Resilient Journal for Black men, as well as I have 2 breast cancer journals. Normally they're all $16.99. Right now they're marked down to $12.99 on Amazon for the next 72 hours. I've got to provide the link in the chat. So we need to do that, or I guess we'll provide the link in the wake up space today. I'll provide that to Cheryl and Shawnee when we debrief. So please do check those out. And then thank you for everybody's time and attention this morning. Thank you for your comments. Thank you for your open-mindedness, for just being here and rocking out. Thanks for your questions. But most importantly, thank you for your time. Like, our time is like one of our most valuable resources, and we can't get our time back. You know, we can make more money, we can catch up on the work later or whatever, but we can never get our time back. So that you spent the hour and a half of your time listening to me, I'm so grateful. Next slide, please.
All righty. So contact information, what you said, but this is reiterated. We dropped in both the thread for Facebook and Zoom. Anything else you want to say about contacting you?
Follow me on Instagram and on Facebook. On my Instagram, yes, I talk a lot about breast cancer, my breast cancer journey, but I'm always talking about all things COVID, just talking about things that support our overall health and well-being. The bottom line is that, you know, the formula for health is very simple. We need to get some sleep. Shawnee and I were talking about that. Get appropriate sleep. We need to eat well. We need to move our body. We need to be hydrated with water, and we need to be in movement. We need to be in motion. We need to be taking action. So that's a space where I'm always just talking about those things and talking about what I'm up to. I like to keep people informed. I like to keep my people informed, and I like to present the information as it pertains to us. So follow me over there. Reach out to me via email if you have questions, comments, concerns, and I'll get back to you.
Yay. All righty. Love offerings. So there's not a monetary figure that you can put on making sure that you are healthy and well and aligned and informed, and your family and those who you care about, that they're safe because you are following protocols and covering yourself and making sure that other folks are safe too. Alexea has blessed us this morning, and so we ask that you bless her back. She mentioned time, and I have been saying this a lot. I'm like, that's my most important currency, and we still need the currency of fiat, money, cheese, coins to survive and thrive, and build generational wealth, family, which we talk about a lot in this space. So please do use Zelle, QuickPay, Soul Leadership Development at gmail.com to give a love offering, and we intentionally call them love offerings, because we love the facilitators that come into this space, and we love everybody who co-creates these sessions with us. So please do give. If you want to give via Cash App, it's $ Spirit of a Woman, and you can give that way as well. Make sure that you use the code #663AG. And that's not aggressive girl, that's Alexea Gaffney, even though she is an aggressive, assertive girl. But her name is Alexea Gaffney, Dr. Alexea Gaffney. So make sure you put the code there so she can get the monetary love offerings that have been given. So thank you, family. And we remind you once again that the automated love offering opportunity is available to you. If you're new to the space, or if you're seasoned in the space and haven't done this already, you can just put it, set it, and it will come out monthly, and you'll be giving to this awesome space that continues to give to you. And the amount of material that we've received over the last 2.5 years is just invaluable, worth millions of dollars. The facilitators that come in here and provide complimentary information. So, our giving back is a drop in the bucket, not dismissing it, because, everything that you give is super valuable. But I just want to remind us of what we get, and we don't have to pay an entry fee to get it. So that will be dropped in the chat. So the next 2 days, our beloved sister, Sanya Zen, Haru Negron, will be up tomorrow facilitating a 30-minute session, or a little more probably, called Salute to the Senses. And we love her. I love that we have these images of folks, 2 women, 2 men in this space today. Just it's powerful. Partnership, co-creation, connection. So our next session will be on Thursday, September 1st. So we're going to start off the month with Omari and Andre, Stepping Into My Power. And they are going to be awesome. I love that they're going to be doing that. And they have a new and burgeoning friendship and relationship as colleagues. And I just love what they're putting together for our futures. So please do set your alarms and just be present. The Woo Nation welcomes all new members. I saw that there were some folks that were here for the very first time. Welcome, welcome, welcome into the Woo space. Woo stands for Wake Up, everybody. And we have a Woo Nation, Woo Tribe. We say woo-hoo, Woo-licious, all of that good stuff. And now I have a new one from Sister. She says, Woo morning, Woo morning. So yes, I love it. I love this creative community. So come back so you can continue to learn, elevate, and ascend. No one and done. We are a family that continues to connect and connect and connect. Our schedule, Sunday, Tuesday, Thursday, 7 a.m. to 8:30 a.m. Sometimes we run a little longer. And then Monday and Wednesday, 7 to 7:30 a.m. All of it is 7 o'clock hour. Wake up, take your vitamins in the form of Wake Up Everybody, and then head to work, school, or whatever you're doing. And if you want to be reminded each morning, type in the number 74121, and then in the in the text box, type in capitals Woo Nation, and then send it off, and we'll receive that automated alert to send you out texts each morning to remind you to come in here with the links and what you need. We also have Woo Swag, everybody. It ain't too late. It's still summertime. You get t-shirts, water bottles. You can drink water all year round. Those water bottles are dope too. They're made out of a material that allows your water to stay fresh and cold. We have teacups, coffee cups, journals, a tote bag, masks, like Alexea talked about, because we still need to wear them. And why not advertise Wake Up Everybody on your mat? So buy your swag for gifts for other people, and then just to gird yourself up. Get all the colors of the t-shirts and sweatshirts. Go for it. And we want to thank you for joining us today. Stay in touch, but be safe as you do. Stay in touch energetically, as well as vibrationally, and utilize all of the registration options so that you can connect with us over the next several months before we move into 2023, because we're here in perpetuity, which is a big word meaning forever. All right, so now that we've completed, let's unmute ourselves and give love to Alexea for all that she has provided in this space. So unmute and pour the love shower that we are known for in this space onto Alexea right now.
Good morning.
Thank
Love
you.
you.
Thank you, thank you,
Good
thank you,
morning.
thank you.
Morning.
Blessings to you.
Happy
Thank you for all your
birthday.
Family.
information.
Thank you. Thank you so much. God bless
Dr.
you.
Thank
Alexia.
Thank
So
you.
informative.
Awesome,
I
awesome,
love
awesome,
you.
Thank you,
awesome.
I
Alexia.
love you.
Thank you.
We love
Great.
you.
Awesome.
Yes. Awesome.